episode of Going All In, Get the Edge You Need to Succeed. I am Dr. Erin McKinley, and today we have another awesome spotlight session with Elizabeth Moore from the McNeese State University Masters and Dietetic Internship Program based in Lake Charles, Louisiana. Welcome, Elizabeth.
Well, thank you for having me. I'm excited to be here. I'm excited to do this.
Yeah, so before we get into talking about the internship program, tell us a little bit about you, your journey to RD, and how you landed at McNeese.
Oh my gosh, that feels like so long ago. It's been quite a journey. I actually started my undergrad at LSU and did my first freshman year there, and then life just kind of happened and I ended up having to come back home. I'm from Lake Charles, Louisiana, and fortunately we have a college here in Lake Charles. It's McNeese State University, and they had a dietetics program, and I'd already kind of known that I wanted to do nutrition and dietetics. I kind of put it off a little bit that first freshman year because I kept seeing organic chemistry and biochemistry and all those, and that kind of scared me, but I couldn't get it out of my head. And so finally, whenever I came back to McNeese to finish up my undergrad degree, I just decided to go all in into nutrition and dietetics. I don't know why. I've just always loved nutrition. I liked health, but nutrition is always the part that's stuck out to me more than the other ones, and rightfully so, because I still love it. And so I finished my undergrad in 2008, and I needed to stay back home. So luckily, McNeese State University also had us an internship as well. I finished my internship there, and during that time, I also got my master's in health and human performance with that concentration in nutrition and wellness. And after I graduated with my master's, jobs were kind of fair to slim. So I just kind of took whatever was available. And there was a part-time job at a smaller hospital in this area, and which honestly, looking back now, it ended up being a blessing because I did everything. I did a lot of different educations. I did a lot of different little things. I did a lot of different food service. I just did a lot of everything. Not a whole lot of severe clinical. It was just more general medicine. And it just really was it's just a good professional experience. It kind of gave me that experience I needed just to get started and understand what I needed to do. And so after that, I finally got a job at a local hospital. And the best part about that was I did everything that I ever could have. I started out in general medicine, and then just over time that I was there for about 9 years. I just slowly would take different units over whenever somebody left or somebody wanted to switch a different unit that they were over. And so I was able to be over rehab at one point. I was able to be over oncology at one point. I basically didn't want to shy away from doing any type of units or anything because I just wanted all that experience. And so I could really figure out what my niche was. And then ultimately what I really found myself going to all the time for was the ICU. Every time the ICU dietitian was off, I was always itching to try to get her workload. And so I took over ICU kind of my last 3 years, did nutrition support, and that was really my bread and butter. I loved it. I worked with our ICU team, with the doctors, with the nurses, the pharmacists, case management. It really was extremely just the most satisfying thing I've ever done. And so part of that was, though, I always wanted to get into management. I've always just wanted to make sure I put my mark on everything. And so after I did ICU, I felt pretty comfortable with that, but I just wanted another challenge. And so that came with management. I did that for a year in food service management, and that was definitely a test in itself. But pretty much about a year into that, I always knew I wanted to be a teacher or do some type of education, especially with nutrition and dietetics, but I just never thought that opportunity would come up. About a year into management, I just wasn't really liking it as much, and I felt like maybe I just needed a change. And then an opportunity came up to teach undergrad at McNeese in nutrition and dietetics, and it just was honestly perfect timing. And I always wanted to get my PhD. And so this just was the perfect opportunity for me. And it was just a very big eye opener because I was also a preceptor whenever I was at one of the hospitals. And I thought that teaching would come easy to me, and it really didn't. It kind of took a while for me to really learn how to be a very good preceptor. But one of the things that whenever I finally went into education was I realized how to really deal better with students and how to really map out that education process. And it's really made me realize how preceptors can be better, how educators can be better, and also how the students can be better. So it's been nice because I've been the student, I've been a preceptor, and I've been an instructor. And so I can kind of see all the different angles that are in the program. And so it's just nice because I have a perspective of each one of those, and I kind of see how they all are intertwined. But I'm going to get into my PowerPoint and hopefully give you the information that you need. McNeese State University is a great university. Our master's is in health and human performance with the concentration in nutrition and wellness, and our dietetic internship. So just real quick, Lake Charles, Louisiana is where McNeese State University is located. We are Southwest Louisiana. We are about 2 hours. I'm getting my geography messed up, but we are about 2 hours outside of Houston and 2 hours outside of Baton Rouge. So, and 3 hours from New Orleans. So I like to say we're right there in the middle of like the good stuff, but we're just a small enough town where it's easy to get around to all the different rotation sites. Traffic's really not a big deal, but it's still a younger town. We're growing. And Lake Charles has really found a really good, young, healthy group of adults that are trying to make it a better community. And most interns who have come from other places who aren't from here have really enjoyed Lake Charles. Maybe not all of them, but some of them. It's definitely not Baton Rouge crazy, but it is growing in its youth, and it's definitely been enjoyed by a lot of different interns. But a couple things. So overview. We are accredited by Ascend. We have to be. We're an 18-month program. So we start in a fall and then we end in the next fall. So it ends up being about 18 months. And I just want to say that sounds, I know most internships are 12 to 2 years, and it just sounds like a long time, but it really does fly by. And so just don't ever let the time frame deter you from any program. We have 10 spots. We have 10 interns each year. Sometimes those come from all over. We've had somebody from Alaska. We've had people from Minnesota. We've had a lot of different interns from all over the United States. So we're not just used to Louisiana people. We've had a lot of different interns from all over. Our cost is pretty much $4,400 in-state per semester. Out-of-state, it is $6,900 as of like right now. We do have grad assistantships that pretty much all of our interns have been able to utilize that can take at least one half of that internship, tuition off. So just understanding that you can possibly have a grad assistantship if you want that. We've been able to get everybody who wanted it a position somewhere, either working in the library, working for our director, or doing some type of work where they can get a discount of 50% off. Our dietetic internship fees are $1,000. And there's just different equipment and things that are in there. I would assume that most everybody is an academy membership, but just those are just some of the main costs that we're looking at. But I think knowing about the grad assistantship, and that's a possibility, really does help some people to come over to McNeese. Okay, so our mission requirements, what we're really looking for. Obviously, you need to have a degree, a bachelor's degree from an Ascend accredited undergraduate program. So having that verification statement, a minimum GPA, overall GPA of 3.0, and then your dietetics GPA of 3.0. Now, yes, we do have 3.0s as our minimum. Have we taken people a little bit under that? Yes, at times, but those also come with strong recommendations. They come with, I think the recommendations, they come with, one of the things that I've seen is some students have had strong, really dietetics coursework GPAs, but overall GPA might be a little bit lower. And that might be, for instance, a student that might have started off in nursing and they did nursing. It really wasn't for them. They didn't do well in the classes, but then whenever they switched over their degree to nutrition and dietetics, they figured out that's what they liked. They became focused and their GPA went up from there. So that's why we kind of like to have both of those, the overall and the nutrition and dietetics coursework. So that's kind of why we want both. The 3.0 is definitely where we want you to be at, but we have made, we've made exceptions depending on the student. Experience is definitely preferred. paid or unpaid, meaning either you're volunteering or you're working as a nutrition, a diet tech in a dietitian's office, or you're working in a food service management program in a hospital. Just something, some type of experience is very helpful. It just shows that you're dedicated to becoming a dietitian in our program. And of course, the GRE, because we do have the grad school, a minimum score of 286 is really what we're looking for. In our handbook, we have the verbal score as 146 and the quantitative score as 140. But really what we're looking for is that overall 286. So if you're kind of slightly off from those, but your overall is 286, we're okay. So this is what our current curriculum looks like. And I just kind of want to show just a couple things about this. So we start in the fall, and that's all online when you first start. So your first semester in that fall is all online. And there's no, there's different things that we'll do during that, but it's all online. Your coursework is. Coming up in the spring, that's when you start your dietetic internship along with your other coursework. So you really won't start clinical rotations until that spring. So it's kind of a good thing, because if you're not from Lake Charles, then you can pretty much stay home that fall semester and do your coursework from home. And so that if that's something that is interesting to you or is luring to you, that's a good idea. But the dietetic internship does follow that next spring, and it falls into the summer, and you'll finish it up in the fall as well. But pretty much, I don't know what else to really say about this. We do have exercise and physiology, the human performance, and the internship. But I think really understanding whenever you start your dietetic internship, those rotations is probably more important to most of the students. But what I really want to show is that we are going to have a new curriculum, hopefully fall 2021. We feel pretty strongly about that. If not, fall 2022. We'll know a little bit more hopefully soon. But we are going to be moving our master's from health and human performance into nutritional science. So I wanted to put both of these because this probably will be the one that any new graduates that are picked in this upcoming selection process will be in. But if not, they have the other one to refer back to. So a couple differences about this one. If we go back, when you do the internship, the way it is right now, when you start your clinical rotation sites, you basically just go to one site, like one hospital, and you basically finish all your rotation. You start in general medicine, and by like probably the 9th week at that place, you are in ICU, and then you're done. You're not going to be back at that place unless you want to go back there for staff relief at the very end. I hope this makes sense. But the way we wanted to redo it was in the fall, when you start your coursework, most of the coursework is online. There are some classes that do require to be in person, but in that fall semester, most of that coursework will be online, but you will start your clinical rotations. But instead of it being just nutrition the supervised practice, we tried to call it Clinical 1. And that way we're starting all the interns at Clinical 1 at the same time. Because the way it works with the old one is that you might start at a hospital on your very first site, but not the person next to you, not your other classmates. They might start somewhere like WIC, or they might start somewhere in food service management. But this way, everybody's starting in the same spot, kind of the same time. And so it just helps to have a little bit more, just making sure that we're making sure everybody is passing clinical the way they should be. And so it kind of goes on to that spring 2, you're going on to clinical 2. So you're going to go on to more complicated nutrition assessment. So more ICU, nutrition support, renal, oncology, those kind of things. And that was kind of our thought process in that. And we really wanted to have the master's in nutritional science with agriculture. We wanted to make sure that we were really trying to broaden the amount of research that we are doing in our graduate school, especially community nutrition research. And so in that summer, the other part, it says Dietetic Internship 1. That's where you're doing more of your community rotations and more of your food service management rotations. And so we paired it up like that. And then that way that when those semesters are over, the students get more breaks. The way it worked with the old one, once you started your dietetic internship, you really don't get a break until the end of November. There's a couple breaks in there. There's a spring break in there. There's 1 week at the end of the summer, but that's pretty much it. This way, with the new masters, you will finish the fall semester. Once that's over, you don't come back till the next spring. So you at least get a couple weeks just to kind of catch your breath, kind of revamp, reorganize yourself. And as somebody who's been through the internship, I think it's better that way. It gives you a little bit more time to figure out what you need. And so you're not just getting slammed into one supervised practice, one rotation site after another, and not being able to really take a moment, look inside, figure out what you need to do, and move on to the next one. What does a typical day look like? Well, one of the things that happens right now is our orientation. You start your schoolwork in the fall, but before clinicals start, before you really start going into our rotation sites, we do have an orientation in January or prior to starting your rotations, that we will have an orientation where we'll go over the different sites. We'll have preceptors come in, talk to the interns, trying to kind of prep them for what to expect, what kind of scrubs they need, what do they typically need, because some rotation sites are just going to want different things. Some preceptors are going to want you to have a calculator and your medication book. Some people are going to want you to have all these other things, and just knowing what to expect and what the person's face looks like. So I think being visually ready is very important. One of the other things that is helpful with this is that we give the interns a completed rotation schedule that is pretty much where they're going to be from the beginning to the end. And we give it to them at the very beginning. And that's helpful because you can look at your entire schedule and you can figure out if you have something scheduled, like if you have a wedding, if you have a doctor's appointment, something where you can at least figure out where you are and what preceptor you need to contact. I don't know how most interns are, but being very organized is something that we like, and so that they can always make plans. Rotations are from Monday to Thursday, and typically you're looking at an 8-hour day. Most interns going in sometimes ask me, what are their typical days going to look like? And I was like, just be prepared that you're basically going to have a job from Monday through Thursday. You may not be there the full 8 hours, but you need to be prepared to be there the full 8 hours. So it is kind of like a 32-hour week. Sometimes the preceptors will ask you to be a part of other things that may not fit into the Monday, Thursday. Whenever I worked at one of the hospitals, we'd have the interns be part of our health promotions. Sometimes we'd have things on the weekends, and we tell our interns that you need to be prepared to do those things, because we definitely want to help out our preceptors and give those experiences to the interns. Travel with us, I'm not sure how other places are, but travel in the McNeese State internship is not very extensive. Sulphur is one of our hospitals. Sulphur's just right over the bridge. I don't know how many of y'all have been to Lake Charles, but it's not too big. You can pretty much get from one place to the next, from one end of Lake Charles to the other within 15, 20 minutes. So Sulphur is only about 15, 20 minutes over the bridge. Jennings about 45 minutes going the other way on I-10 towards Baton Rouge. And then Leesville, Louisiana, the only time that they go to Leesville is during the summer when we have diabetes camp. Now, we missed out on diabetes camp this past summer because of COVID, but hopefully we'll be able to get that one back this summer. But those are pretty much the extensiveness of the travel. Sometimes the interns will travel with the preceptors. I know one of them traveled with our school board director and went to Baton Rouge, but the director drove and brought him back. So those kind of things. But just making sure you have reliable transportation is important, just to be able to get to Sulphur and back, Jennings and back when you are at those rotations. So just some ideas of what those look like. So currently, I'm just going to show you the clinical rotation sites. And whenever I say clinical, you're going to be doing, one of the things is that I've noticed is that some hospitals are more specialized in bigger cities, but these hospitals, all they're seeing is just everything in that one place. So you're not going to have like one hospital that's just for burns or just for oncology. You're going to see everything there. So when you go to Christus St. Patrick's Hospital, you're there for 8 weeks. which is a good thing because you really get comfortable with the preceptors, you get comfortable with the location, you get comfortable with the computer system, and you are able to really immerse yourself in the hospital and get comfortable and be able to really grow as a dietitian. And then Christus Lake Area Hospital, all these hospitals are pretty much within 5-10 minutes of each other. So really that's the benefit, that you really aren't going to put a whole lot of wear and tear on your car if you come to McNeese. And if you hate traffic, we're the place for you. But these are definitely just some of the hospitals where you will spend a lot of your clinical rotation sites. The best thing also is that our preceptors, a lot of them have been through our programs or they've been here a long time. So they're very used to having interns, and they're very used to what they need to do. We have a lot of really very good preceptors that have been very liked by a lot of our interns, and we have done really well with our clinical. And so that's just something that's always been what the interns have said at the end of the program, that they've really enjoyed the preceptors. They've helped them. We just have been very blessed in that. The community rotation sites, we have the school board, our endocrinology clinic, our ag extension services, our dialysis clinics, the WIC, of course, and then Louisiana Lions Camp is the diabetes camp, and you spend 1 week there. Now, one thing that you should know as a disclaimer is that this is Chef Buddy right here. I don't know if you can see my mouse. And this is the, I don't know, I guess the mascot for the Calcasieu Parish School Board nutritional program that they got. And so one of the things that the director does during your 2 weeks there is at one point you will be wearing this suit. I don't know how many people have worn this suit, how they clean this thing, but that is part of that rotation site. And a lot of times we've had a couple of crying kids, but that's okay. That's an experience. But all these have been really good. One of the things that is really, probably our school board has been one of our stronger sites, one of the ones that our students would really like, our interns really like. All right. So one of the important tips that I like to say, because one of the things is I'm looking at like all the different places and what you should know just to be successful. Anybody should know this. You need to start your application process in DICAS pretty early. Don't wait till the last minute, because you want to be able to check for accuracy. You want to make sure that you made sure you paid all your fees, you didn't miss something, and get those transcripts ordered, because sometimes I find that a lot of students don't order those on time. Sometimes they come in late. And that doesn't always look good for you in that application process. Get your 3 recommendation done, and then give yourself enough time for the GRE, studying and being able to give yourself enough time. If you feel like you might not get that GRE 286 that you need for our program, you at least have enough time to retake it, because I think it's 2 or 3 weeks before you're able to retake the GRE, if that is the case. And definitely know those application due dates. Know the DICAS one, the matching, and then any program. I think it's February 15th this year. But one thing also, though, whenever you go and you are an intern at any place, what you shouldn't do, what really makes a good intern. That's another thing that I really liked, is that I was a preceptor for 9 to 10 years. And it really helps me to know what these students need to do to be prepared whenever they go into an internship, or what I looked for whenever I was a preceptor. As long as you don't have to know everything, but if you show up prepared, if you show up showing initiative, you're appreciative of the time that preceptors are giving you, because being a preceptor is not extremely easy. I remember being an intern and thinking, we're doing all the work for these people. There's no reason that they should be complaining or not enjoy us being here. So you can see that I've changed a lot. But one of the things that's helpful is that you're being appreciative of their time, because it really takes a lot to explain what you're doing with patients, why you're doing it, why you're giving so many calories, all those kind of that teaching process. And so just be very respectful and appreciative of preceptors, because they really do a lot, and they're not always paid. My dog's whimpering off to the side. But also enjoy the process. I really don't remember my internship too much. I feel like it was a blur, and I kind of wish I would have taken a moment to really enjoy the process, because sometimes you get so wrapped up in getting done and being finished that you just kind of miss out on just having a good learning experience. Couple things: application and admissions. if you meet the admission requirements for our dietetic internship program, you will meet the application requirements for McNeese, because I think their GPA is just a tiny bit lower than what ours is. So as long as you meet our requirements, you'll meet McNeese's requirements. I put our program website in here for a couple things. It'll bring you to application processes, a lot more information, and also lead you to our handbook, where we'll really break down a little bit more of this information that I presented. And then also the McNeese graduate admission website. That'll lead you to things like the grad assistantship, the admission process, what they need, and also if you're out of state or if you're an international or a transferring student. It just has all that information that you might need for those. Contact information. Current DI director is Dr. Hollingsworth. I am in the undergraduate program, but I definitely am in the selection process for our interns. I've been a preceptor and I deal with the interns when you are there. So just contacting either one of us would be perfectly fine. And I just think thanks and good luck, and just let me know if y'all have any questions though about that.
All right. Thank you so much for providing that information. All right. We'll jump into the 5 questions that I ask all folks that come on the podcast. And these questions were put together with the help of the LSU students, really focusing on what they want to know from these different programs. So the first question is, what is something that you especially love to see when you're reading a personal statement?
It's funny when I read the personal statements, it's almost like doing an assessment as a dietitian. There's just certain things that stick out to me. One of the things that I really like to see is, of course, when I'm looking through the application, one of the first things I like to look at is the GPA, not because it's defining, because it's just where I like to start and just get an idea. And then I like to go look at their personal statements and really see, did they make it specific to McNeese? Is helpful. And also, if they felt like they have a GPA that's not very indicative of how they are as a student, are they willing to basically address that? Did they veer off because they weren't dedicated, and then they figured out what they wanted to do and they kind of changed their track and were able to get serious and all those kind of things. I think also being very open to if they have any discrepancies. I just like to see them very personal. Sometimes they seem very bland, like they're just very generic. I like to really feel like they're really writing this because they're to a McNeese applicant person. Those are really the things that I really look for. If I can really tell if I'm reading you, or just if you basically blanked out McNeese State and you just can put in a university.
That is annoying, especially if they accidentally put the wrong name on there.
Yes, or they missed where they put that.
All right. Well, my second question is a true or false question. True or false, an applicant's resume should be 1 page and 1 page only.
Oh, no, you got this. This has been something that the older generation that I know always want the 1 page. And then you have some, I honestly am so ADD, give me 1 page. I want 1 page. I want to be very specific. I think sometimes students get wrapped up in trying to cram everything in there. And I'm like, what you really are trying to do is get their attention. And then when you speak to them, you can tell them all that other more specific stuff. I think 1 page really is the best way to go.
So what is one thing that an applicant may do, and this could be either in their application package or maybe in some interaction you have with them through email or maybe an open house or a Zoom call, something. What is something that they may do that might raise a red flag or might be a total deal breaker where you're thinking this person might not be the best fit for our program?
One thing, I'm trying to think of red flags. Red flags to me, like if I'm just going to look and be very general, would be like blanks in the resume. What did you do if you took time off, like a year? What did you do during that year? If you took time off in school, what did you do? And it doesn't have to be specific. It could just be personal reason. It doesn't have to say, oh, I don't know, I went to rehab or anything crazy like that. It just, just really showing that you haven't veered off. And that's one thing. GPA is tough. I'm just trying to think. I really like strong recommendations. And so when people are going to give you a recommendation, you really want to have somebody who can really show a true recommendation, somebody who can really show strengths, but also be willing to open up on weaknesses. And that shows me that they really know you and they can really be a testament to who an intern be the intern that you can be. Some people can look really good on paper, and whenever they show up, they can be not the most ideal intern. And so I really, as a preceptor, and then now as in the education role, I see that GPA doesn't always have to be everything. You do have to be a strong student. It shows that you're resilient. You can push through and still make good grades. But showing up, asking questions, being open to taking criticism are always the most beneficial things, I think, as an intern.
Okay.
So I don't know if I really answered it. I'm trying to think of the red flags. I guess
think about has there ever been a time where you've been reviewing applicants and you're like, whoa, no.
One thing is somebody spelled dietitian wrong in their statement. That drove me nuts. When you have font and sizes, if it looks like you rushed through your application, some people missed transcripts, they missed application fees. When you do your resume, like, I don't mean to be a stickler, and I didn't think I'd be a stickler about these things, but different fonts, it just shows that you didn't look over it, that you didn't really like think about it in that way. And it's like, you can tell somebody who really took the time to like really put everything down, make sure everything is right, and the person who kind of went through it and just sort of threw it together and just submitted it. And so those are the red flags. Whenever I see things are misspelled, grammar's not correct. And I hate that because I didn't think I was that type of person, but I am.
That's okay.
So, thank you. I appreciate that.
No, that's exactly what I was looking for. Those things where you're just like, no.
Yeah. No. The spelling the dietitian wrong with the C drives me nuts. That was one thing I was like, I get all my students in my very first Nutrition 101 class to spell dietitian on a test. Yeah. And it's in the question. So it's like, if they miss that, then there's just no hope.
Yeah, that's a big deal breaker if they don't know how to spell it correctly.
Yes.
All right. So moving on to my next question. So what is one area of the program that you're working on trying to make even better for the interns?
Well, I think that's kind of why we're doing the masters. We're changing it, bringing the masters into nutritional science, away from health and human performance. We kind of want to have our hands on it a lot more. And also we want to expand on community research. Right now, I'm doing my PhD dissertation. I'm working on it and doing food insecurity in college students. And what our ultimate goal is, or my ultimate goal is that we'll have a running survey that we can have over a span of a few years and really show how that data. And then that way students can really see that how they can go into clinical settings and actually do research. I think a lot of times they don't know how to go into clinical and do that research in that setting. And so those are kind of the things that we really want to do. Also, going from just throwing everybody into different internship spots at different times. You know, somebody's doing ICU whenever somebody hasn't even been to a hospital yet. That's why we kind of moved to the clinical one, and everybody's kind of in the same boat at the same time. And I think that makes it better for students who struggle more and better for students who are stronger. It just kind of helps where we can all address that at one point versus I haven't even been to clinical yet and I don't know how I'm going to do, but I keep hearing horror stories. So I don't know if I'm going to do well or not, you know, and it's just kind of puts it all at one point and it makes it better, I think, for the interns.
All right. Well, my last question is a two-parter. And the first part is, what would be the three best adjectives or phrases or descriptors to describe your program overall?
We have really strong preceptors. That's one of our best ones. I think having a group within our program, like me, Dr. Hollingsworth, and we also have another person, Geneva Bro. Dr. Hollingsworth's been doing it forever. I've been in clinical, the most recent, and then Geneva's just recently graduated. So you kind of have different areas. We've all been in different spots. So it's like very helpful for students because they can kind of see different areas and we have all different perspective to give to the students. So that's two. Three, I think one of the best things is that we are willing to just help the students overcome with everything they need to do. to get through the program. You know, we're here to push you. We're here to make you grow. That's a big thing, but also we're here to support you, you know, emotionally, professionally, and just to get you through that process. So I just think the preceptors, the people who are working in the program, and then also the just the overall willingness of everybody to help you get through this process, because it is kind of scary. You don't know what you're getting into sometimes, and you're always going to different rotation sites. So that's hard, but that's a good thing. It puts you in uncomfortable situations, and you need somebody to be able to tell you that that's going to be okay. So that's what we got to offer. When you give me the 3-word adjective thing, I always bomb on that one. So it's like I end up giving like a big spill every time.
No, that's okay, because you have to do it again now. So the second half, very similar, 3 adjectives or descriptors to describe your ideal applicant.
Oh, okay. Ideal applicant. So if I'm looking at an applicant, I really want a very personal statement. I want to be able to really feel like I'm looking at you reading the statement, you know, not generic, very specific, and shows that you are willing to show your weaknesses, but also really gloat on yourself as well, saying what you want to do and that you're dedicated, because we want applicants to show up here and stay here and finish the program. We don't want people coming and leaving. We want people who are going to show up and appreciate the spot, because getting into an internship can sometimes be a thing in itself, and be able to get here and appreciate the spot. Thinking more like when I like to really be able to read their personal statements. I really like a strong GPA. It shows me that they put a lot of effort into their education. I'm not harping on the fact that it has to be the most perfect GPA, but I want to see that they've made good grades in their science classes and their nutrition classes for sure. If I see a bunch of general classes that maybe they struggled with, that doesn't bother me as much. The sciences is what I really want to look at, and their nutrition classes, because I really see that those are the things that we're going to have the classes on. I want to make sure that they're not going to be struggling academically and they can get through the program. I don't know. I'm just trying to think of how I really have been able to pinpoint. I like the recommendations. The recommendations for me are what sell it. And I think really not just trying to find somebody to fill in your recommendation spot, finding somebody who is going to be able to be a testament to you. Really, that's another way for somebody really to, like, you know, root for your team. I think those are really strong.
All right. So we will move on to some questions from the students that are with us that are in the chat.
Awesome.
And Jewel asks about how many people apply to the program each year.
Each year, I want to say we've been having a lot of undergraduate McNeese students apply. We've been having bigger and bigger senior classes. Like this past year, we had 10, but usually we get about 15 applicants each year, maybe 5 to 10 outside of McNeese, depending on how big our senior class is, but usually 15 to 20 is what we're looking at.
Okay. And there's probably 2 answers to this question, but Jasnika asked, what percentage of graduates pass the RD exams on the first try?
I'm trying to think of where we are right now with our group that just finished, and they're just coming up on their year. And I think because of COVID, a couple of the tests have been pushed back, and somebody had a baby, so that got pushed back even more. Never mind. But I'm looking at the second question where it says, is it possible to have a job and successfully complete the internship? I definitely think that that's possible. The one caveat about that is that some students get a job, and I tell them, I'm like, you need to be prepared to be there for 8 hours a day. And sometimes you might have to be there longer if you're taking a longer time for assessments, or you're struggling and they're giving you time. Sometimes we've had students who are like, well, I need to get to my job. I'm like, no. The internship is your first priority, and the job is the second one. So definitely finding a job. Can they have a job? Yes. We've had some that definitely have jobs. A lot of them work on campus for the grad assistantship. A few of them have really worked to get the library jobs, which have been good for them, because typically it's a very low maintenance job. They're getting paid. They're getting half off on the tuition. And also they're working in the library, so most of the time they can study, and they're getting paid to do that. And that's been a big thing with a lot of our interns, is being able to get that job in the library.
The RD exam pass, that is public information. So for those that are interested in getting it, you can email Elizabeth or Deborah, and they can provide you that information.
Yeah, I don't know off the top of my head. and I don't want to say the wrong number, but I know it used to be the first time, and now it's within the first year. I know we had a couple have to retake it. I feel like the amount of percentage of students we've had to retake the exam has gone up in the past couple years. We had 1 year, and I don't know really why that is. That kind of was, I don't want to say a stigma whenever I was going through school, like if you didn't pass the first time, but I feel like the amount of students having to take it a second time has kind of increased in the past couple of years. And I don't know if that's a McNeese thing or what, but I saw that as a preceptor and in my first year whenever I got to McNeese. But I don't know what that percentage is yet, but it is public information. So if you email me, I'll definitely give that to you.
And I think we moved to tracking it within the first year of taking it because students were needing a second try, because it did get harder. It did get more difficult to pass. And I know at my previous institution, students were taking it to see what it was like.
Yes.
It would fail and then know what to study. And that's not the bet. That's a waste of $200 and however many dollars.
That's what I was thinking. And then also the ones who had to retake it again, I'll be honest, I had to retake it again. And that was like, I don't want to say that's for everybody, but to me, that really, I had to get over more the feeling of that I didn't pass it over than anything. And I've seen that with other people who haven't passed it. And it really takes a lot of, perseverance to really get over that. And so I think one of the things is like, you could look at the pass rates, but what I would say, it really has to come down to the student and them prioritizing taking the exam and making sure they're studying it. I think one of the main things where I went wrong is I just thought I could wing some of the food service. And then you get in there and you're like, that was the biggest mistake of my life. Like knowing the laws, knowing the formulas, and just kind of not taking that as seriously as I should have. And so I think that that's been helpful telling students. And I think the ones who have really put in the time to prepare for it have done well.
Do you require the students to take any kind of exit exams from the different rotations, or do you guys have or partake in one of the national reviews at the end of the internship?
I don't know about the national review. They do. Every time you finish a rotation site, you get graded by the preceptor, whether you can proceed or not. And there have been some that have failed a rotation site. And when they do fail, they have to go back there. And you have to work with the preceptor to figure out when you're going to go back there. And sometimes it's been when you have that week off, they've had to make up that rotation site in that week off. And they know from the very beginning, there should be no surprise if you're failing a rotation site. You should pretty much have that idea that you're not getting it. Something's not going right from the very beginning. And that should be the preceptor's responsibility to also make you aware of that, and the director, so that you can do some early interventions to help make that. That's another reason why the clinical one's going to be well. So if you do go in and you have somebody who's struggling in clinical, you can kind of address it and everybody's in the same boat at the same time. And it's just a little bit easier to see what other people are doing. Why are they getting it? I'm not. And I think that that's kind of the benefit of doing that as well. I think Lake Charles is a great town. It's growing. It's got a young community. We do a lot of stuff pre-COVID. Hopefully that'll all come back. We have Chuck Fest in the fall, which is amazing. But if you ever have an opportunity and you're running through Lake Charles, you can just let me know, and you can come meet me in person and ask any questions, or we can do it virtually. I keep forgetting we're in a pandemic. Sorry.
As we close out tonight, Elizabeth, give us one last take-home message for potential applicants this year.
I think you just have to be yourself and just really find it within yourself to like really put down. I think one thing is in the personal statement, don't be afraid to toot your own horn, really sell yourself. Some people find it not very, they don't want to boast about themselves, but I'm like, do that. This is your opportunity to tell me why you're the best applicant. And I just don't miss that opportunity to really use your own words to tell me why you would be a great addition to our program. We're a great program. Interns usually like us a lot, and we just would love to have any person who wants the experience.
All right, perfect. Well, thank you for being with us. And for those at home, If you're interested in getting more information about the program at McNeese State or to get in touch with Elizabeth or Deborah, I've included the website to the program in the description below this video. And as always, don't forget to like this video and subscribe so you never miss an episode with another dietetic internship. And we'll see you next time.
Thank you so much.